Our third Champion in Global Health Award goes to Professor Michelle Stevens. Michelle hails from Jamaica. She joined Rutgers in the spring of 2011 in the Department of Latino and Caribbean Studies and holds a PhD in American Studies from Yale. She is also a psychoanalyst and publishes work on the intersection of race and psychoanalysis. To those that know her, it is known that she accomplishes more in one day than most of us do in a week. Adding on to an illustrious career and leadership positions, she recently took on as the founding director of the Rutgers Institute for the Michelle and the Institute for the Study of Global Racial Justice have actively engaged with the Rutgers Global Health Institute to make this issue a priority when confronting health inequity. Through the initiative Black Bodies, Black Health, Professor Stevens partnered with Anna Branch, Senior Vice President for Equity at Rutgers, to fund grants, workshops, conferences, and scholarly writing aimed at addressing structural racism to create more equitable health outcomes. Racism fuels the social and economic inequalities that lead to health disparities both in the U.S. and globally. And the partnerships that Michelle has fostered to explore the intersections of racism and health have proven both fruitful and impactful. As a 2024 Rutgers Global Health Institute Champion in Global Health, Professor Stevens demonstrates that addressing structural racism will be essential for achieving health equity, not only in the U.S., but worldwide.
To be receiving this award. I was really pleased and surprised when you let me know. So my thank you to the Rutgers Global Health Institute. My congratulations to my fellow awardees, John and Brent. It may seem obvious to all of us how an institute that focuses in health and an institute that focuses not just simply on race, but from a humanistic perspective would have something to converse about. But when you actually try to put that together, it's challenging, right? We work in very different parts. The humanists and health researchers work in very different parts of the university, right? It's not as easy as it sounds to think about how we might collaborate. I could not have thought about that without Rick, your help, Rick Marling's help, and being invited to be a part of the Rutgers Global Health Institute community so early on was really instrumental for helping me try from my perch to think about how to create a conversation, or really more how to make visible the different kinds of conversations that are possible between our different communities of researchers, many of whom overlap, which is what I'm very proud to say that with RGHI's help, I feel like we have actually created some of those networks over the course of the last few years of ISGRJ's existence. For example, I was really pleased to work even very directly with Rick and wonderful colleague, Arpita Jindani, as we work together on some small grants, working on creating training modules for anti-racist teaching within the health equity space. That's just one example of the kinds of projects that kind of have emerged out of our work together. I also just personally, Rick, want to thank you for your mentorship as a leader. I think I really looked to what RGHI had created, the challenge of creating this campus, university-wide entity that is a gathering space for multiple kinds of scholars. I think, Brent, you're exactly right, that can be very, very daunting in the kind of highly decentralized Rutgers landscape. And from the second that Chancellor Strom suggested that Rick was one of the people I should speak with, it's been nothing but helpful, inspiring, guiding for me to look at the model you've created here, all of you together at RGHI. So I just also want to thank you personally for helping to kind of bolster my own efforts to create something similar in the space of the ISGRJ. So very honored. Thank you very much.